Okay, so we've just had handover and we've heard about our patients and had a little look through. You've got some objectives that you need to meet on your placements. Taking those into consideration, are there any patients that you think you can work with to meet some of those objectives today?
Well, I was working in the bay yesterday in 7 and 8.
Yeah.
And I know that 7's query discharge today, depending on blood results.
Okay.
So I'm quite happy to take those two as well.
Okay, yeah.
Okay, with me, I'm quite happy to take 1-5.
Yeah.
He's going into theatre, and I haven't had any experience on to do the checklist and take any patient in theatre, so I'll be happy to take him on.
Okay. Yeah, that would be good. So are you happy to start that process, and then if you have any problems, come and find me, and then I can come and support you?
Okay, yes.
Is that okay?
Yes.
So I'll take 1 to 4, and then if I've got anything with those patients that I feel that you would benefit coming and helping me with, I'll come and let you know. And then Tracy, if you take 5 and 6.
Yes.
Yeah. And then Bridget 7 and 8.
Yes.
Yeah. So priorities for this morning. What do you feel you need to get done first?
So I think the TTOs were sent off yesterday, so I need to probably chase those ones
Okay.
up. I'm not sure if transport's been booked for him.
Okay.
And I should probably look into the possibility of letting the care home know
Yeah.
as to what time
Yeah,
transport.
I think that would be a good idea. Call them and see whether there's a more convenient time
Yeah.
for them. Let them know that it will probably be morning, and then just continue to
That's
update.
absolutely fine, yeah. And also probably the EDS as well.
Okay.
See if the doctor has started that or completed some of it as well.
Okay, good. Tracy?
For me, I need to make sure the checklist is done and make sure his observations are stable
Okay,
before he goes. That's my priority.
okay. And can you think of anything else that you might need to do alongside that checklist?
I was thinking to make sure that he's got
So like maybe a hospital gown? Yeah.
and then also check if the names and bands
Yeah.
are correct, if they've got any allergies or
Yes.
something like that.
Yeah, okay. Well, if you're happy to start that shortly then,
Yeah.
come and let me know if you have any issues and I can come and support you. We can resolve it. And if you've got anything together that you want to do to try and resolve, if you're struggling, come and let me know. We can work through it together.
Yeah.
Okay. Do you want to spend a bit of time looking through their notes over the last few days to see what's been written by the medical team and the physios and the multidisciplinary teams?
Yeah.
Yeah?
That's absolutely
Okay. Hi, should we have a little catch up?
Yeah, sure.
So have you found this morning so far?
It's been good so far.
Yeah, have you come across any issues that you need a bit of support with?
The main issue is the care home is reluctant to take 1-7 because of physio. He's
Okay,
not as baseline, he's not really mobilising with us.
okay,
So I'm not really sure what the step is
okay.
to do that, as it were.
So what would you normally do if we had a patient on ward who we needed physio to come and see?
Make a referral to physio?
Yeah,
Yeah.
so we need to speed things up a little bit if possible.
Yeah.
So what do you suggest?
Do you reckon we should bleep them as well and make them aware?
Yeah, it wouldn't do any harm because I think they're finished on the ward for this morning.
Yeah.
So yes, do a physio referral form.
Okay.
Have a little look for his notes and see what physios have wrote previously,
Yeah.
and then give them a bleep and just explain your conversation with
Okay,
their
so-
care home,
Yeah.
and then we'll regroup again in a bit.
Yeah.
Yeah,
sounds
is
good.
your other patient okay?
Yeah, so 8's absolutely fine. He's been reviewed by the doctor and it's just continuing the treatment plans and medications.
Okay, and you're
As
all
usual.
happy with that?
Yeah, absolutely fine with it.
Okay. Tracy, how did you get on?
Yes, 1-5, he's alright.
Okay.
But there's been a delay in his operation. It was
Okay.
supposed to be at 10 o'clock,
Yeah.
and now they've changed it to be in the afternoon at 1 o'clock.
Okay.
And at the moment, he's complaining of thirsty. He wants something to drink.
Okay.
So,
So have you explained that he is still to be nil by mouth for now?
Yes, I did
Yeah.
explain that to him. But
Okay.
he's quite
He's
dry
still-
mouth and everything. So.
Okay. What other ways do you think that we've got of helping somebody with fluids?
I thought we'd talk to the doctor and see if there's anything that they can
Yeah.
give us to give him at the moment?
Yeah, definitely. It's worth looking. So do you know where the fluid section on the drug chart is?
Yes.
Yeah, so if you maybe have a look through that first.
Okay.
And then are you happy to bleep the surgical team that he's under?
Yes. I'll do
Yeah.
that. Yeah.
And just let them know about what's happened and that he's complaining that he's feeling really quite dry,
Okay.
and they should come and buy some fluids up.
Okay.
And everything okay with your other patient?
Everything is fine with 1/6. His orbs are stable and he's eating and drinking well.
Okay.
And maybe home later.
Lovely. And then I will update you if I hear anything else from the doctors.
Okay.
Okay?
Thank you.
So what have you enjoyed about being an CLiP model?
For me, I've enjoyed just working independently and not being able to be stuck with my mentor all the time.
I've enjoyed the teaching element of it, having the opportunity to not only teach other students but also secure that knowledge within myself.
I've absolutely loved the fact that I've got a responsibility of my own patients. I'm responsible for their care, so I can oversee that with the help of obviously third year students and the nurse in charge as it were. But I also like the learning hour, where you can go do your own research if you wanted to, and I found that really beneficial as well.
Yeah, I enjoyed having my own tasks to do and just making sure that they're done and taking care of my own patients. Just managing my own patients is what I enjoyed the most about it.
Yeah, and the same with me as well. Sometimes mentors aren't always approachable, so having a student that you know is in the same boat as you, I find sometimes it's easier to approach them if I'm coming, like if I've got a problem, because I don't feel like they're gonna like tell you off almost for not knowing. I think they're just a bit more approachable sometimes.
So Kaylee, as the third year, who's been the student in charge of the CLiP Bay, how have you found that, and do you feel it's prepared you more to qualify than perhaps a one-to-one mentor model?
Yes, I do, because I feel like I've had to work on prioritising my own workload, but also supporting and coaching other members of staff as well, which has come along with its challenges because everybody works so differently, everybody comes from different backgrounds, we come from different working backgrounds, different ages, and I think having the opportunity to work with not just one other student but a handful of other very, very different students has been really, really helpful. And I think that I've learned a lot in the last 12 weeks that will enable me to support students when I'm qualified and they're working with me.
And as first years on your first hospital placement, how have you found it? Is there anything you would have done differently or anything you would have changed at all?
For me, first time, because it was my first placement in hospital, and the first day I had CLiP, so I didn't really know much about some terms that they use in hospital. So it would have helped me better if I'd had like my mentor for a week, and then after that, then start CLiP. So I'll be familiar with all the stuff on my handover.
I think for me, where I've had a little bit of hospital experience previously, it was quite beneficial for me because I did know my way around the ward and sort of bits and pieces which people might not necessarily know straight if they've not had any care experience previously. So I can see your point of view, but for me it was good in the sense that I wasn't given responsibility before, and I just love that fact about it.
I sort of would be the same. It would have been nice to have sort of like one-to-one support, but also I felt like it was sort of too much for me in the beginning just because I didn't know what I was doing because I wasn't in the hospital before. So some support would have been good, and then sort of go on to CLiP maybe a bit after.
Yeah, the same with me. I've never been in a hospital environment, so to have your own patients is quite like a lot of responsibility all of a sudden that you're not used to, and you're just trying to like find your confidence, find your feet at first, and then to be handed up these patients, like it is like quite scary. But I think with the support of the coach and the other students, like you build confidence really quickly on it because you're just thrown into it. You've got to get it done. So like, I mean, in just 5 weeks, I've learned so much from other students, from the coaches, and like I feel so much more confident than I did on my first day. So I think it's been really good.
Yeah, same with me. I have enjoyed now the CLiP and I can carry on doing it
Yeah.
because I'm much more confident than the first time I started.
Because I think as a ward, we kind of tweaked it slightly. So after that first day, so I had been on the ward for a couple of weeks before on my own, so I had picked up the routine of the ward, so I was quite settled. And then all the new starters come in and we went straight into CLiP, and we could see very quickly that it was just too much for everybody to take in. So we did tweak it, and we spoke to some of the other students and said, would you rather work so still in the CLiP bay, but one-on-one with like the student in charge? So you would have a caseload of patients that you would look after together, and it's really helped one of the other students who isn't here today. I think it has. I can see that she's grown massively. So I think that just adapting it in a way that suited those individuals has helped. I don't think it doesn't have to be so structured. I think it can be kind of tweaked a bit to suit whoever you're working with.
And what advice would you give for the new first years coming into CLiP brand new? What advice would you give them?
Don't be shy to ask if you don't know anything. You know, there are lots of people who are there to help you, and
Definitely ask questions.
Yes.
Like even on our ward, in our learning hour, a lot of the time we'll go through the handover, and if there's things that we're not sure of, our third year will know and explain them in more like terms that we would understand as first years. So I think definitely is just ask questions if you're unsure.
Also become familiar with the paperwork,
yes.
and definitely ask questions, because there is a bit of paperwork, which is nice and is part of the job, but obviously make sure you fill out correctly.
I'd say maybe don't put too much pressure on yourself and just take it slow, because you'll get there sort of eventually.
I agree with that, and I remember back from when I first started my training, and I was continuously comparing myself to other students and other members of staff and people who'd been qualified for years and years. So I think it's really important to remember that we were all at that point.
And I also think it's important, like when you make a mistake, just say it as soon as possible, because I was one, I did make a silly mistake when I was recording some observations, recording the wrong person or something like that. So when you do something like that, just say it quickly so that the nurse in charge would know.
And would you all do CLiP again?
Yes.
Yeah.
Definitely.
Thank you very much.